Gardner. I'm the Director of Strategy at the hospital, and I've just been through a patient's journey from an inpatient through to cardio-respiratory for an echo, to understand kind of how it makes our patients feel. And well, Gina just said that I look a bit traumatised, and I think, I mean, to be honest, it was quite uncomfortable. So it's quite a long way to be wheeled down the corridors, and feels particularly strange when you go through the main entrance. Almost feels like you're being wheeled through a shopping centre in a bed, which feels quite uncomfortable because, you know, there's kind of lots of people kind of looking at you. And I think the other thing is you really notice when there's like rubbish trolleys in the corridor. You're being wheeled past rubbish, you're being wheeled past other patients. So there was someone who'd just come in from an ambulance, which I was, if I, you know, did have a genuine condition like the patients that would be going through this journey, I'm probably already feeling quite anxious and perhaps breathless. And then to see someone who has just been brought in as an emergency, A, might remind me if I've been brought in as an emergency, and B, kind of makes me worry that I might be like that. I think the other thing that I noticed was there's quite a lot of people in the corridor who are in their own little world, including staff who therefore oblivious to the porters trying to push a bed, and that feels quite uncomfortable as well. You feel like you're in the way because they're not paying attention, and therefore they're kind of walking into the bed. The porters told me that they would normally talk to the patients and reassure them, so that's nice, and they seemed really friendly and helpful. When we got to the cardiorespiratory department, they took me in, but then there was already a bed in there, so they had to take me out again and leave me on the corridor not for long at all. But I think, again, if I was a patient who was, particularly if I was worried about my breathing, because that can make you really anxious, to be left on my own on the corridor for any amount of time, I think would be really scary and really uncomfortable. So I think that's probably, for me, one of the worst bits of the journey. So then I went back in, I went into the room to have my test, and it was really difficult to get the bed into the room. So they had to kind of shift the bed again to try and shut the door. The second thing, probably after being left on the corridor, that made me feel really, really uncomfortable was when the person doing my test said, did I mind if they locked the door so that we wouldn't get disturbed? Now that felt just a bit weird, like I was in this really tiny room and then I was being locked in. And I'm sure there are reasons why the staff have to do that so that they don't get disturbed, but from a patient's perspective that felt really uncomfortable, particularly as then you're essentially getting undressed in a room where you've been locked in. So yeah, that wasn't very nice from a patient's perspective. And so then I went back to the ward after my test, so kind of very similar journey to the way there. I think probably some patients might have to wait a while when they come out of their tests to call the porters. That wasn't the case in my example, but I think that does happen sometimes. So I'm sure that there's lots that we can do to improve that patient experience, and hopefully we're going to do that through listening into action. We're going to help the team to make those changes, and maybe I'll see you again in the new improved patient journey.